Hello, everybody. Welcome to Ask Dr. Bob. And you may notice I look a little different. Well, why is that? It's because of our theme. Our theme is summertime and diabetes. And what are some summer tips? And I am off location, so I am at the ADCES meeting. What is that, you wonder? That is the annual meeting of the Association of Diabetes Care and Education Specialists. Those are the people that can really help you manage your diabetes. So I'm here in Baltimore, and we are going to talk about summer tips, summertime. I hope you're all having a wonderful time. My name is Bob Gabbay. I'm the Chief Scientific and Medical Officer here at the American Diabetes Association. This is where I answer your questions for those of you that are new to the program. So let's jump right in. So what's the first question? Why are people with diabetes more sensitive to heat, or I'll say in what ways? And I think that's a great question to start, because I don't know where you are, but it's been a hot summer. So first thing to keep in mind is how heat affects diabetes, and in a few ways. One, when you're hot, your body sort of has to spend energy to cool you down by sweating. And that energy is like exercise. So what does exercise do to blood glucose levels? Well, it lowers it. It uses up energy. It uses up glucose. So one important thing to keep in mind is in the heat, your blood glucoses can drop too low. And we'll talk more about that in a moment. And then the other thing to keep in mind, the other thing to keep in mind is the heat can affect the tools you use to manage your diabetes, your medicines, and the monitoring you may do. And we'll talk more about that in a moment. So that's the first question. Let's move on to the next one. And I've jotted all these out here. So what precautions should I take in the summer with my diabetes? And that's the next question. And probably the key is staying hydrated. Staying hydrated. Drinking. I'm going to keep saying this through this segment because that's probably the single most important thing. If you get nothing else from what we're talking about today on Ask Dr. Bob, it's staying hydrated. And for a number of reasons. So when your blood glucoses get high, it by itself dehydrates you. And then, of course, sweating dehydrates you. And the feeling you might get from being dehydrated and overheated could feel like low blood glucose, or low blood glucose could feel like you're overheated. Because what happens when your blood glucoses get too low? You sweat. So it can be hard to know if your blood sugars are getting too low. And so that's the next piece of this, is not only stay hydrated, but monitor your blood glucose levels, whether that's with finger sticks or continuous glucose monitor. It's important that you have a sense when you're hot, when you're sweating, that you're not too low, and that the activity that you're having is not driving your blood glucose too low. So it's staying hydrated, it's monitoring, and then the third thing is how it affects your medicines. So you may absorb, if you're taking insulin, you may absorb the insulin quicker, and it may have more of an effect, number one. And I want to spend a little time talking, because this was one of the questions about what to do with their supplies in the heat. And so insulin needs to be kept at room temperature. It's good at room temperature for about a month. So you store it in the fridge, but you can take it out of the fridge, and as long as it's at room temperature, not 95, 100, for some of you, depending where you live, 105, 110, the insulin will go bad. And so you need to find ways to keep it cool. If you have it with your person, that's a good sign, because your body is not likely to get too hot. But that may not always be the case when it's 100 degrees outside. But what you don't want to do is not have it with you, meaning you don't want to leave it in the car, for example. It'll spoil and it'll be unreliable. So keep the insulin with you. And then there are actually a little insulin koozies that you could put them in to keep it cool, or Frio bags that you can keep your insulin cool, little mini ones that are designed. So you may look around for those kinds of things. So keep your insulin at a normal room temperature so that you get the most effect from it. Okay, what other questions do we have? What happens if I get sunburn? Let me tell you, you can probably tell from my skin, I've had some sunburns. I'm sun sensitive, so I totally get this one. So what happens when you get sunburn is your body's even working harder to cool yourself down. And your blood sugars, again, could drop too low. But if you're really badly sunburned, it's almost like being sick. You can get heat stroke, your body temperature can go up, and your blood glucose levels can go high. So again, another reason to be monitoring yourself and checking your blood glucose levels. Okay, next question here. So can I exercise safely in the summer? And I encourage people with diabetes, all of you, to stay fit and exercise. It's great. You just have to take a couple of precautions. And again, it's staying hydrated, drinking. It's monitoring your blood glucose and making sure your medication, if it's an injectable medicine, is kept at room temperature and kept safe. So the other question that I got here is, so what kind of fluid should I hydrate with? And, you know, I think that the best thing to do is just water. If you're going to drink something that has electrolytes in it, which can be helpful, but water usually is all you really need. Just watch out that it's not with sugar in it, because of course that's going to raise your blood glucose levels. So keep an eye on the fluids. Keep drinking. How do you know if you're drinking enough fluids? How can I tell? Well, one easy way is to just monitor how often you need to urinate, because what goes in's got to come out, right? If you're finding that you're going several hours and you don't have to go to the bathroom, you're probably not drinking enough fluids. That's one way to know. So, and you really can't overdo it. So, err on the side of overhydration more than anything. And remember, high blood glucoses will also dehydrate you. So, you have an added reason if you have diabetes to stay hydrated. Okay, so we're on Ask Dr. Bob. It's summertime. We want some more tips. Let's see what the next question is. Question here about what should people with diabetes be thinking about to protect their feet? Well, I'm glad you asked that. One of the challenges is that people with diabetes may lose some of the sensation in their feet. Some of you may have tingling or burning of your feet, which is a sign that the nerves are damaged. And because of that, you may, if you go barefoot, can injure yourself and not realize it. I had a patient recently that she really burnt the bottom of her feet pretty badly because she didn't feel that the hot sand was burning her feet. And so it's important to wear some kind of foot protection to protect your feet. Flip-flops, great. Anything like that is wonderful. But going barefoot can be a little dangerous, so be careful. Okay, the next question, there's been a lot of severe weather and thunderstorms out there. People have lost power. And this person says, what should I do to prepare? And I always tell people to have an emergency kit. What do you have in your emergency kit? It's whatever you use to monitor your blood glucose, whether that's your meter and test strips or your continuous glucose monitor, CGM. So have that, have your medications, have a flashlight handy. And again, you need fluids. I can't emphasize enough how easy it is to dehydrate. So keep fluids handy. Moving right along. So one of the things that happens pretty commonly for people is, they wear sensors or insulin pumps, and they have challenges with sweating, and these things fall off from the sweat. What can you do? Well, let me give you a couple of tips. One is you can actually apply a little antiperspirant to the area. So let's say you're going to put insert your pump or continuous glucose monitor. First thing is to make sure the area is wiped dry. So dry your skin, because you may have been sweating already, and then put your device on. If that's not working, you can, I've had patients that have used antiperspirant in the area and then put their pump or sensor on. And then there are a bunch of sort of special adhesives that make things stick better. And they're, grip and pump peels and skid grips. There are different things out there that can help that adhesive stick better during the sweating. And if it falls off, you just have to reinsert another. Okay, we're winding down with 2 or 3 more questions. So this person says, I'm about to go on a trip for a couple of weeks, and what do I need to do to be prepared? Well, summertime's a great time to travel, and a lot of people are headed to the beach and different places. Always bring more of your medications and test supplies than you need. Generally, I recommend 2 or 3 times the amount you think you need. Let's say you're going for 2 weeks, bring a month's worth, because you just never know what might happen. Always better to have a little extra than not enough. So that's number one. Bring extra. And here's something where if you're flying, do not check your supplies, your diabetes supplies. Keep them with you. Don't check them, because nowadays baggage is getting lost all the time. Let me see. Do we have any other questions?
We do.
We have a question. Abby, thank you.
Yes, we have a question from Marcy. Marcy asked, "What about insulin stored inside the Omnipod? Will the heat affect that insulin storage as well?"
Oh, great. So the question is insulin in the Omnipod, which is a insulin pump that is on the body. What about that insulin? Will that be safe? Because it's close to the body, it's more likely to be at body temperature and more likely to be safe. But if you've been out at 100, places in the U.S. have been 110 degrees, you've got to watch out, and it can be problematic. So keeping your body cool, if you're uncomfortable, your insulin may be uncomfortable also. Any other questions, Abby?
Yes, we do have another question, just related to feed in general and diabetes. Someone asked if you could what you suggest about like blackish toenails, and if you get those in the summertime.
Yeah, someone likes black. Black.
Their
toenails turn
black.
Their toenails
are turning black.
I see, the toenails are turning black. So usually that's a fungal infection. Not always, and you should always talk to your healthcare provider about what that might be. Sometimes it can be an injury. If it's painful, you should seek attention, because there are reasons that it could indicate something more serious. But if it's a long-standing sort of blackish kind of toenail, it's probably a fungal infection. Not dangerous, but hard to treat, because the usual fungal infections, athlete's foot, you're probably familiar with, you can treat with various creams, and the creams are able to get at the skin and treat it well. The toenail grows really slowly, so even if you paint stuff on it, it takes a while, weeks, and sometimes you need to take actually tablets, prescription medications to treat that. So Lots of good tips here. This is Ask Dr. Bob, and I want to leave you with maybe the most important thing is to enjoy your summer, be active, just take the right precautions, stay hydrated, monitor your blood glucose, keep your supplies safe and at room temperature, and have a great summer. Follow me, I'm on Facebook, Dr. Bob Gabbay, on Twitter, on LinkedIn. Tell your friends. Have a wonderful summer. This is Dr. Bob Gabbay from the American Diabetes Association saying, have a great summer, enjoy, and see you next time.